So welcome everyone to this session on titled "PrEPing the Young Gay Dude," organized in partnership with, organized by YVC, the Youth Voices Count, in partnership with APCOM and the MSA, the Global Fund HIV Program, the Multi-Country South Asia Program. So Youth Voices Count is a regional network of young gay and young trans people in Asia and Pacific. We have a presence in about 22 countries with over 140 members. And since last year, 2015, since the Preparing Asia consultation that was organized by APCOM, Youth Voices Count has been engaged in the discussions around PrEP and working with different regional partners in terms of making sure that young gay men also a priority population for gay PrEP demonstration sites in the countries where that is already taking place. And today's discussion, what we actually want to do is have an honest discussion about the social implications of PrEP. So please note that when I say social implication, it doesn't mean anything negative, but we're going to talk about some things that we also not talk about when we are trying to discuss about PrEP and its implementation and when the populations are concerned. So most of the time what we try to discuss when it comes to PrEP is how effective it is, the biomedical side of it. But today what we want to discuss and what we want you to contribute is what do you think about PrEP in a socio-psychological sense for young people and even for people generally. So there's so many myths around PrEP, there's so many accusations against PrEP that it encourages certain behaviors that are risky or that would actually increase incidence and all of that. So and we would like to keep this session informal as much as possible so that we can contribute, talk with each other, and have a focus on young people and PrEP, especially young gay men. Without delaying it, I would like to introduce Senior Programs Officer, Advocacy and Programs Officer of APCOM. APCOM has been doing a lot of work around PrEP in the region, actually starting the discussions around PrEP in Asia and Pacific with Preparing Asia consultation in 2015. So in that, please take over the floor and just give us an overview of what APCOM has been doing so far in terms of PrEP. Yeah, you can. Oh, you can take the mic.
Thank you, Ilka. Hello. Can you hear me? Yes, you can. So my name is Sinad. I'm the Senior Programs and Advocacy Officer, Senior Advocacy and Programs Officer of APCOM. And we have, APCOM is a regional organization working towards the improvement of male sexual health. But since we are growing as an organization, we have also expanded to work with the human rights related issues of MSM, gay men, and other members of the LGBTIQ community. So APCOM is working in the whole Asia and the Pacific region, and we have partners at different countries in Asia and the Pacific. Our work is based on 4 pillars, advocating for community services for MSM and other gay men and other MSM. Second is advocating for legal environments or creating enabling environment for our communities. Third is gathering and generating strategic information, which means gathering data and gathering evidence and providing that to the community so that they can make use of something in their advocacy. And the fourth one is capacity building for young leaders and capacitating leaders at all levels. Last year, in 2015, as Lucas mentioned, we have organized Preparing Asia. It's the first biggest and community-led consultation on PrEP in Asia and the Pacific. And we have gathered 135, next slide. Can you just control it?
Oh yeah, sure.
Yeah. So we have gathered 135 representatives from all over Asia and the Pacific, including communities, civil society, government, policymakers, political health service providers, and development partners. And it was conducted in a span of 3 days, where there was healthy discussions on the efficacy of PrEP, The World Health Organization presented evidence on the efficacy of PrEP based on the studies conducted in England, Canada, and United States, and France, the ILGA. So we have dissected the consultation to determine whether or not the PrEP is, or whether or not the MSM are ready to use PrEP, whether or not the service providers are ready to offer PrEP in their countries, and whether or not the National AIDS Program managers are ready to include PrEP services. So the consultation have found that MSM in general are ready to use PrEP if they have heard about it, and if the PrEP services are available in their country. And then the service providers are ready to offer PrEP if they have understood the efficacy and to whom should it be targeted, and if the health system, including the National AIDS Plan, officially supports the service at the country level. And the National AIDS Program managers are ready to include PrEP if they have been aware of PrEP, if there is a guidance or clinical practice guidance to guide them in their work, and if there is used available data and evidence on HIV incidence among MSM, and if there is a existing legislation to support the inclusion of PrEP in the national AIDS plans. So since last year, APCOM has provided technical support in different countries in the region to provide or to assist the community in organizing their own consultation, gathering the members of their own community, gathering the health service providers and the national AIDS programmers. And we have provided technical support so far in Laos, Philippines, Indonesia, Singapore, Malaysia, and in the next few weeks we will go to Cambodia. So we are currently using the Prepare in Asia model in providing technical assistance at the country level, where we have provided, gathered community members of the MSM or MSM members of the community, the health service providers, including the clinicians, the nurses, the outreach workers, and the national AIDS programmers who sits in within the Ministry of Health or the agency of the Ministry of Health, and discuss whether or not it is feasible to provide PrEP at a country level. So APCOM is also conducting several advocacy efforts towards the promotion of PrEP. So we have included, or so we have designed memes in our social media platforms and Facebook. These memes presented key messages on PrEP. So like for example, that PrEP is effective, that PrEP is recommended by the World Health Organization and the Center for Disease Control. That PrEP is like protecting your body against sunburns. So it's like what do you call that? An SPF. PrEP is like wearing a life vest while traveling on a boat. PrEP is taking oral contraception, take it or leave it, the option is yours. And PrEP is a program and not just a prescription. So the formulation of these key messages are not just, in a snap of a finger that, okay, we'll just decide, let's put these messages on the memes. But last year, APCOM has formed a steering committee composed of the UNAIDS, the World Health Organization, the members of the community, the regional organizations, to actually sit down and discuss the feasibility of having PrEP consultation in Asia and the Pacific. And the members of the steering committee has actually guided APCOM in the development of these key messages and make sure that these key messages are in lay language, but it does not go away, or it does not deviate from the clinical facts of the efficacy of PrEP. So we wanted to use analogies that the MSM can actually relate to, such as using sunblock, like a life vest, and making sure that they understand that PrEP is not just a one-time prescription, but it is a program, and it requires routine HIV testing. It requires regular monitoring from clinicians, and it requires regular monitoring of kidney and liver. So in addition to those means, APCOM also has this Test DKK campaign, or testing campaign in the region. So it's a region-wide testing campaign called Test XXX. So the last three letters, XXX, stands for the city code where we are implementing the campaign in partnership with our country partners. So for instance, in Bangkok, we call this Test BKK. And in Test BKK, we have a website, testbkk.org, and we have included the messaging on PrEP on our webpage. If you can see, that's one of our sub-campaign, Fuck Without Fear. So the tagline for Test BKK is Suck, Fuck, Test, Repeat, which we are actually promoting testing. They can, I mean, MSM can suck and fuck, but they should have a HIV test, and then they can repeat sucking and fucking again, and vice versa. So the campaign actually makes HIV testing a part of the sexual behavior of the MSM, particularly the young MSM. And we have included a sub-campaign on PrEP with the tagline "Fuck Without Fear," because we have in Bangkok only we have there's an evaluation conducted wherein the testing relates to actually, I mean, the low number of testing in Bangkok actually relates to the fear of young MSM in taking the test. So we have used that notion of they should go to testing centers without fear, and they should fuck without fear by using PrEP, ensuring that they believe that PrEP can actually protect them from HIV and is effective. We have provided different FAQs in our website, and this is the posters that we have for the PrEP campaign of the Test BKK, which is venue based. So we have developed different posters targeting different subgroups. So this one is targeted to serodiscordant couples. This one is just for fun. The tagline is in Thai, but then it's fuck without fear. So this one is serodiscordant couple. This one is for people who likes to have two or more. Yeah. And we have also launched our campaign on big parties in Bangkok, knowing that Bangkok hosts different big parties in the region. So it's one of the hub of the gay people or the gay men in terms of partying. So we have Songkran and we have White Party during the New Year. So in Songkran, just this year, we have launched our PrEP sub-campaign. We have our booth and we have distributed some campaign materials on fucking without fear and directing them towards where to access PrEP. We have produced several resources from last year. So this one is the full report of the Preparing Asia. We also have an executive summary report of Preparing Asia, wherein I have presented a few slides back the findings of the consultation. So we also have included in our advocacy during the high-level meeting on the inclusion of innovative prevention method, which includes PrEP, in the political declaration of HIV and AIDS in New York. And we have published or launched our Changing Gears. So it's an MSM framework wherein it guides the national AIDS programmers and the community-based organizations in designing programs targeting men who have sex with men at a country level based on country context. So the MSM framework has 4 components, and one of them is the inclusion of innovative prevention means, which is the inclusion of, or which includes PrEP. So I have been asked during my previous presentations, why do I keep mentioning the word innovative or innovation? But actually UNAIDS, in their UNAIDS report 2013 and in their report in 2015 has defined innovation as actually an inclusion of, or an implementing or scaling up of services which are scientifically proven and scaling up of services at a country level. So the innovation of all the HIV prevention methods has yielded different kinds of tools at a country level, and that includes pre-exposure prophylaxis based on studies conducted in different countries all over the world. So that's why when we say innovation, that means scaling up or implementing scientifically proven methods in addition to the existing HIV prevention tools. We have participated in AIDS 2016 this last July, where different staff of APCOM has actually presented the findings of the consultation. When you look at here, joined the meeting with the World Health Organization in their development of the PrEP guidelines, is it? the guidelines on PrEP. And Midnight, our executive director, has also has sat down in different panels and shared the lessons learned and experiences on how to conduct PrEP consultation that will be led by the community at the country level. So the Preparing Asia has been seen as a model by different, not only in Asia and the Pacific, but also in different regions such as Europe and Africa, where APCOM actually went to Russia, Tbilisi, Georgia, Russia, and South Africa to provide technical assistance in organizing PrEP consultation with community members, health service providers, and national AIDS programmers. So we are also developing in partnership with UNAIDS a regional investment case where we wanted to prove that PrEP is one of the cost-effective means of prevention, and the countries or the government can actually save more money if they give front load money, funds, investments in prevention. So if you visit our website, apcom.org, there are several resources and materials available that speaks on PrEP. So we have the videos from consultation, we have the photos, we have the education video, and the posters, the promotion poster that we have for pre-exposure prophylaxis. So all in all, APCOM promotes PrEP because it believes in its efficacy based on the studies that has been conducted worldwide, and it also promotes PrEP as part of the existing prevention method, so that the MSM has additional choices in preventing or in protecting themselves against HIV. And when we say the MSM community, we include the young people or the young MSM because according to data, it is the young MSM who are more at risk of getting HIV infection, and the latest incidence rates actually presenting that the MSM aged 15 to 24 are the ones who has the highest incidence rates on HIV in Asia and Pacific. Okay, so that's from my part of what APCOM is doing on PrEP, and I'm gonna hand over the microphone now.
Great. Thanks, Imad. Thank you for presenting all that in a very short time. I know it was 27 slides, so he actually skipped some of them. I was glad. Great, so I'm not going to delay it. So I'm going to introduce Aries. Aries is the youth officer for UNAIDS regional support team here in Bangkok. So he will be the moderator today, so handing over to you. And we are live streaming the session, so we are getting some questions, but I thought we're not going to ask them now. We will post them to the panel at the end. Okay.
Okay, thanks. So we'll have an honest discussion as you right. Okay, he left the room. So we'll have an honest discussion, and the title is. Can you put it up? The title of the session. Anyways. Yeah, prepping the young gay youth. Okay, Inad rightfully presented here. PrEP is really new here in our region. Actually, besides the 6 countries, I think in total there are 10 countries here who's either doing rollouts and some pre-site assessment, so pre-assessment rollouts here. So it's really interesting to look at that one. But everything started here in Thailand and Preparing Asia. So we'll meet some of the users, PrEP users, who are accessing PrEP here in Thailand. And I think we're not going to discuss the biomedical aspect of it, as you have already said. We're going to look at the psychosocial aspect of PrEP. So really looking at zooming into the users. Okay? To do that, we have 4 dudes, because this is prepping the young gay dude, who will be giving their perspective. So, should I invite all of you here, and then I'll present you? And if you have questions, we'll have Q&A later, and you can be as blunt, as truthful as you want. Okay? Okay. So first, let me introduce to you Garrett. Garrett is from Australia, and he's the Director of Partnerships and Programs of Asia Catalyst. And Asia Catalyst is an NGO which focuses on health and human rights of marginalized communities in China and Southeast Asia. He also worked with IPPF and Marie Stopes International. We have also Tanzil Ul-Rehman from Pakistan. He's a program manager of the Stana Male Health Society, and it's an organization working for the health and rights of MSM, gay, and bisexuals. Here on my left is Jonas Bagas. He's from the Philippines. He's an HIV and LGBT advocate. He's currently based here in Bangkok working with Apcaso, and he is a PrEP user, and he started in July 2015. And our young gay dude using PrEP is Yuan Vu from Vietnam. He started using PrEP in March 2015, and he was the manager of the Blue Ribbon Boys campaign of Hornet. I think everyone knows what Hornet is, no? Vu is Vu is presently the coordinator of ILGA Asia. Okay, welcome to our panel. So we'll start with looking at the user. So Vu, you're quite famous here. You have your videos here about PrEP. So I'm really interested, and we are interested, how did you come up with that decision of using PrEP?
So I think if you follow my YouTube channel or you watch my videos, then you got the answer. But if not, so I think growing up as a gay man in Asia, everyone, if you probably have heard a lot about also HIV, especially if you go in the cities, I think, and everyone has an impression of the association between being gay and being HIV positive. So I grew up in a house always, had in my mind, I always prepare, okay, maybe probably one day we'll get HIV, because it looks like a lot of gay men get HIV. And so I grew up and I prepared myself for that idea. But then, and eventually I came to terms, okay, probably it's okay because, with medication and stuff, it should be fine. But although thinking that, but I could not ignore the fact that there are still a lot of stigma and discrimination around HIV and people living with HIV. In our region, we had countries who ban people living with HIV traveling. Although for example, Singapore, that they lifted that recently. Am I right? Yeah, I think they lifted the travel ban for people living with HIV. Yeah, in paper, right? And so you see that, and so that's why it was still a lot of burden. And even when I came out to my parents, my mom was like, "Okay, you're gay, so you die of HIV." So it seems like there's a very strong association, and then many times actually in the past where I exposed myself to the risk of getting HIV, and I got really nervous that I would eventually get HIV. So there were times that I tested many times, within a month, like I think 3 times a week. I came back and forth to the clinics because I got kind of, I was nervous all the time, and even the clinics, they had to tell me that you shouldn't go back for the test that many times because it's not going to help you. The results are going to be the same. At least you have to test a month later. And so during that period as well, I also heard about PrEP. The first time I heard about PrEP was quite long ago, actually, about a few years ago when it was first available in the Western countries like Canada or the US or in Australia. But I never thought that I could get access to the drug because it was not widely available and it was so expensive. And also, people didn't encourage the use, the widespread use of it. So it was a long time ago. But then, back in 2015 or 14, in Melbourne, Australia, actually, that was the first time that I heard about the widespread use of the plan for the widespread use of PrEP in the future by the president of International AIDS Association Society. And I noticed that news, and okay, so PrEP is going to be available, and at the price of $1 a pill for a day in Bangkok. So I kept remembering it until early last year, I got into that anxiety again, and I got tested frequently, And then it came to my mind, okay, this time I must get PrEP. Because why not? Like, it's there, and why am I not gonna use it to protect myself and feel better and feel safer? So I insisted with the doctor, okay, I don't know what you're gonna do, but I need PrEP, and you just have to instruct me exactly how and what I have to do to get it. So, and that's why I decided to get a PrEP.
Okay. And sorry. Okay. And in terms of your behavior, were there any noticeable changes that you've seen while you were using PrEP?
I would say that my sexual behavior, wouldn't have changed the same way. I mean, would have changed the same way with or without PrEP. Of course, this is not like it's not like a study with a control group and experiment group, so I cannot exactly tell the same. But my sexual behavior is still the same. The only thing different that I noticed is my confidence, my feeling, my emotion. I felt much safer. I felt more confident. I felt like I was more protected. And I stopped visiting the clinic every other week. I stopped feeling anxious and nervous all the time. Yeah.
Okay, thanks. Okay, we'll go now to Jonas. Jonas is a good friend of mine. I consider him, when we were launching the Preparing Asia, I consider him as one of the poster boy of PrEP. And on your video, you mentioned the word empowerment there.
Different video from.
Yeah, different video, because your video is you're always shirtless. There's shirt there for Jonas. So I just want to know, empowerment, how can this little blue pill do that?
Well, just to lay down the context, I'm an HIV activist coming from the Philippines, where the idea of HIV prevention is still about abstinence, monogamy, and using condoms. The thing is, like majority of gay guys in the region, I'm also not a consistent condom user, based on certain circumstances. Whenever I'm in a partnership, in a relationship, then sometimes we wouldn't use condoms. I have a sexual partner who's HIV positive, and in one incident, there was an exposure. I had to look for PrEP here in Bangkok because PrEP isn't available in Manila. What triggered my decision to use PrEP was a conversation among HIV activists. I disclosed that I took PrEP one time, and the reaction from them was just, they were astounded. There was really instant judgment. You're an HIV activist, and how come you've allowed yourself to sleep? And therefore, I thought maybe I should use PrEP for my personal protection, and also at the same time as an advocacy tool to help educate the community. And one reason why I chose to use PrEP is that it's a prevention tool based on your informed choice. It's protection according to your own terms. And sometimes when you're in situations where you have to negotiate for condom use, you are aware that you've taken tests already, that your partner said that he is also HIV negative. There are still lingering doubts, and you find yourself questioning whether you've made the right decision. With PrEP, you are sure, based on evidence, that this actually works to prevent HIV infection. It's not 100% sure, but compared to the other prevention tools, it is likewise effective. The only difference is that this is actually according to your own terms. And that's really empowering because it removes so much guilt, so much doubt in the equation. So for me, I've started to advocate and talk openly about using PrEP among my peers.
Okay, you mentioned judgment among LGBT or HIV activists. It's really good. For you both, Truvada Hor, Jonas, room. I'm not saying you are troubadours. Where you have you been tagged with that negative connotation, and what do you think about it? How are your perception, particularly looking at social media when you are advocating for PrEP, people might be calling you that.
So yeah, you may have heard a lot about troubadour and stuff as a humiliation for those who take PrEP. First, I want to say that to use troubadour or to call PrEP users as a slut or whore is actually a humiliation to sluts and whores. Because I actually looked up, the definitions for sluts and whore on Google just for the section, and whore is basically having sex with someone for money. And I think your body, you wanna have sex with somebody for money, like who are you to stop, right? And slut is somebody sleeping with having a lot of sexual partners, and so why are you having problem with somebody sleeping with other people? Is it because they are trying to sleep with you, or is it because they don't want to sleep with you? Are you having a problem with that? So I think my body, my right. So people want to sleep with whoever they want. That's why I feel like the troubadour horse term in itself is already so wrong, in that you are stigmatizing different people, not only the PrEP users. And that's why when people tell me that are you like a troubadour whore, are you like a slut or a whore, I would ask them, like, do you have any problem with that? But what if, like, I sleep with a lot of people, you have a problem? So I think, I wouldn't take it too seriously about slut and whore and troubadour whore, but I would tell people, stop stigmatizing other people, not the PrEP users, not the slut or the whore, because they all have their own rights and they have their own dignity.
I've encountered a lot of reactions similar to that online, on Grindr, or even on Pornhub. And I think partly that's influenced by bias against gay sex in general. Because whatever prevention tool that you're promoting, condoms for example, people would still react that you're promoting promiscuity. So there's always that equation that gay men enjoying healthy and pleasurable sexual lives are promoting promiscuity, and that's wrong. So that's the first source of the misconception. The second is that the excitement around PrEP is often taken by many HIV activists as a notion that PrEP is a magic tool for HIV prevention. It's not. The magic pill for HIV prevention is a robust HIV program for gay men, for key populations, and PrEP is just one tool. And I think we should encourage more conversations to promote PrEP, because it also puts a lot of subpopulations and key populations into the health system, because you have to go back to clinic to get your supplies. You have to get tested regularly, and I think, and also having that kind of informed choice about using PrEP is a more sustainable form of behavior change, because you make your own decision and you own that decision. So we should counter both, counter that notion that this is about promiscuity, and also counter the notion that PrEP is a magic pill for HIV prevention. It's not really.
Okay, thanks. We'll go now to Tenzil. You've heard from our PrEP user here both the positive and the negative aspect really attached to PrEP. So in your country, where it's really a conservative culture, how do you think the community will accept PrEP, and particularly looking at young gay people? How do you think they will perceive it?
That was I was thinking. The only challenges which I can speak about, like perceived challenges, what will it be? I think non-availability of PrEP is a challenge at the moment, because the majority of our clients are engaged into sex work, where you do not have any control over use of condom and safer sex practices. Even if you have a partner, like, you cannot keep a condom because your partner is going to have a doubt on you that you are engaged into a sex work. And due to the law, it criminalizes sex work. There is a section 371 which says that you cannot buy or sell sex, and there is a section which is section 372 which explains that you cannot even run a place where you can engage into such kind of activity. So in this environment, I think this will be a very useful tool to help and protect people, because majority of our clients often ask us this question that do you have anything else as a replacement? Because if I'm doing a sex work, if I'm standing somewhere or police is going to catch me up, it's so difficult to convince them that I'm not involved into any kind of activity. Even if you are not doing a sex work, this is difficult, right, to carry a condom unless you are married.
Yeah.
Married to a woman. So this is really a challenge. So PrEP will be a very useful tool if I think what in my perceived challenges, the affordability, accessibility will be very difficult, because if this will be available on cost, the majority of the clients have an average monthly income of like $100. If you are going to sell PrEP for like $40, no one is going to spend 40% of their income on this, right? This will be an issue, I'm telling you. And follow up of taking a medicine and using it will be a challenge, because in low income and marginalized communities, the health is not a priority for them. So you can somehow convince and create awareness, and it's better as compared to whenever you use PrEP, you use it as a combination of a condom. But at least when you cannot use a condom, at least you can protect yourself from HIV. And I think for the programming of HIV prevention, there should be a mandatory thing. It should be available in the community-based organization, NGOs. Yeah.
Okay. But as far as you're concerned, there's no start of talking about PrEP in Pakistan.
No one has an idea. I think there are a few participants sitting over there. I don't think so. They have an idea about the PrEP.
Okay, maybe later we can discuss about raising awareness.
Yes, exactly. Exactly, you should.
Okay, Gareth, you've seen examples from them in terms of as a PrEP user and challenges in Pakistan.
Yeah.
Do you think it is a right of a young gay person or a young person to access PrEP?
Long question, boring answer. I like that everyone else gets to talk about barebacking and I talk about human rights law. That's awesome. But no, I think it's an important thing to start to digest, because I think the examples given are really important. Vu, from a personal perspective, said this is a right, this is essential to me, and I'm going to advocate for getting it. Jonas, you were talking about programming and that it's not a silver bullet, that actually it's part of this prevention, robust programming. And when you start to look at, do you have a right to PrEP, those things are mentioned directly in terms of how we take human rights law and how we take the right to health. So I'll give a bit of background to that, but I will put it back into programming and what we can do next as activists. Everyone has a right to the enjoyment of the highest sustainable standard of physical and mental health, and that's broken down in various parts. I'm sure a lot of people here know a lot about this. Within that right to health, there's specific areas that we can look to for whether or not we have a right to PrEP. One is the prevention and treatment and control of diseases, and the other one is conditions around medical service and medical attention in the event of sickness. That sounds a little bit like it's more treatment than it is prevention, but when you go into it, again, you have specific elements that you can start to access as an advocate that wants to look at getting involved with or getting access to PrEP or promoting it. And those are specifically goods and services, physical and mental health, PrEP, tick that box. Access to basic preventative health services, again, ticking that box. And the provision of essential drugs, which may or may not be depending on your government and how they kind of feel. Regardless though, all governments or the governments have an obligation to establish prevention and education programs that are robust, that are diverse, that include condoms, that include PrEP, but also make available relevant technologies and implement strategies of infectious disease control. I think that goes to the last presentation around innovation. So actually that definition of innovation that APCOM just gave us in terms of making it scaled up and as part of the programs that are done. So yes, Do we have a right to PrEP? Yes, we do. It depends how you want to go for it. Is it an essential drug that you want to go for, or is it actually part of kind of what Jonas was saying, your robust programming? However, having a right to something doesn't mean that governments are going to take it up. Doesn't mean that you individually need to take that up. You know. So again, it's about thinking about your own risk assessment, what you have access to, and things like that. That takes you to, you know, how are you going to implement that right, either in your own life, at the doctor's office, or for a community, or whatever.
Okay, thanks.
No worries.
You said you want to talk about barebacking. Okay, let's talk about barebacking
Whoa.
now.
Okay.
In the context of PrEP, do you think that it will really reduce condom use, particularly here in the region where it's already low?
I think it's hard for me to talk about this region. Obviously, I can talk about my own experience. Technically, Australia is Asia Pacific, but most of the people in the Asia Pacific don't care about us and don't want to invite us, and I get why. It's fine. I think, no. I don't think that that's going to happen. I think people have reasons why they seek the sex that they, you know, enjoy. And for some people, condoms are going to be what does it for them. That's what makes them feel secure. That is the kind of sex that they want. And there'll be people that don't. And we have all a right to accessing various programs that are going to fit for, you know, the sex that you want to have.
Okay, maybe we'll ask the Asians.
Yeah.
Yeah.
So weird. But so I think of barebacking or having sex without a condom as a issue of consent. It's very simple. Two people, they want to have sex. If one person want to use the condom and the other one insists that I don't want to use the condom and try to have sex with a condom, I think that's not consensual sex. It's not good because you're having sex against somebody's will. It's not just about forcing somebody to have sex, but this is like forcing the kind of sex. But if two people agree that okay, so we're not gonna use condom when we have sex, and it's consent sex, and nobody has problem with that, I think there's no reason why people should stigmatize these two people or these three people or more. I don't know, but I think if somebody agree on the kind of sex that they have, they should be allowed to do that. They should have the freedom and the right to do that. An outsider has no way to impose what kind of sex the people are going to have in privacy. Even if you tell them you must have condom, you must use condom because we have sex. But at the end of the day, they're in their private room. They do whatever they want. So, yeah.
Jen, you want to add something?
I think, especially in countries where HIV incidence is rising, that's not the only question that I would ask. I would also ask whether access to HIV services has increased. Are there more gay men or bisexual or MSM going to clinics? Are cases of STIs getting detected early and getting treated? Or are HIV cases, new HIV cases getting detected and treated early as well? So it's not really, I hate this pitting of PrEP versus condoms, because we know that the situation is complicated. We have more tools in preventing HIV infection, in addressing the HIV epidemic. So the question isn't just about whether this reduces condom use, but all these indicators and handles around your HIV programs for gay men, MSM, and trans people.
Yeah, totally agree. So when we're looking at PrEP, it's within the framework of combination prevention, condom with lubricants and other prevention options. But since we're going to barebacking, let's go now to chemsex.
What?
Chemsex.
Oh.
I'm not. Okay, so
Explain what chemsex is.
you know chemsex, right? Okay, so having sex with using recreational drugs like yaba here in Thailand, or
What is
shabu,
Java?
or methamphetamine, right? Yeah. So using that. So PrEP, do you think it will increase that kind of sex where they use recreational drugs? and anyone can respond. Is there a danger that PrEP will frame that, because of PrEP, we don't, we mentioned already condom, but chemsex will also rise.
I don't understand the part where PrEP will increase the use of chemsex. To me, it will encourage the use of chemsex because if people wanna use drug and have sex at the same time, then they're gonna do it without PrEP. Just like what I talked earlier about me that PrEP wouldn't have changed, my sexual behavior over time. So it would change in the same course with or without PrEP because it's really about how I feel and really my pleasure and my emotion. So PrEP was there just as an insurance, as a protective tool, rather than without sex. If I decide to have sex with or without a condom, like I won't put on condom because I don't have PrEP, or I wouldn't take off condom because I have PrEP. It's really when I have PrEP, I still use condom. When I think that when I actually can use condom. So I think it's pretty independent. So I would say the same about chemsex. If they wanna have drug and have sex, and then PrEP is there, then it's good for them. But PrEP is not there. It's not gonna stop them from doing that because at the beginning they already want to do that. So it's just.
But maybe that notion that because they don't fear anymore HIV, they could just have that experience of how do you say this? Freedom in terms of sex using recreational drugs.
Because I feel like they feel safe when they have PrEP. So isn't it a good thing though? Like when people feel safe when they do anything. I think when even if you use drug or when you have sex or whatever you do, I think it's important that you feel safe when you do it. You feel like you're protecting your health and you're maintaining good health.
I think it's interesting because I know that people make that correlation all the time, and I think we don't know enough about chemsex cultures from, we're talking about not biomedical stuff, we're talking about cultures around it. So if you have someone who has never engaged in chemsex, but as a young person they have a clinic that they can go to where the doctor will proactively bring up PrEP and say, hey, you are 18 or you're 17 or whatever, you're experimenting with your sexuality. Is this an option for you? Do you think in the next 3 months you're likely to have unprotected sex? So then you could possibly have young, engaged men or whoever already on PrEP by the time that they do experiment and go to, a chemsex party. But also you've got this idea that at the chemsex party, like the only thing that they're dealing with is HIV. Like you've still got to organize the venue, you've still got to get your dealer, you've still got to get a whole bunch of stuff going on, and that requires harm reduction and organization and stuff like that. So it's likely that these people seem like they've got their stuff together as well, and that maybe they're on PrEP as well. And just the idea that that's the one thing that maybe a chemsex group would be dealing with, and now that they're not fearful of HIV, it's all on. Like I think we do need to stop and think, all right, so what is the chemsex culture, and why are young people maybe attracted to that, or people already involved in that? Maybe they're highly health-seeking people that are well organized, can organize a dealer, get everyone together on a Friday night, pick the venue, blah blah blah. It's event management 101. But it's also highly intelligent people that possibly organize already interacting with care. Also, PrEP may be a motivation for groups of people who aren't already in care, and then suddenly they're every 3 months. Not only they're having discussions around their health around HIV, but then suddenly it'll be like, hey, have you been hitting it pretty hard? How's your drug use going, etc.? You're already connected to care. So again, this sounds like a fantasy of all these magical things that can happen, but I don't think we should jump straight to you go on PrEP and then you go on a 5-day bender.
Tanzil, in Pakistan, what you've been hearing about barebacking chemsex, do you think that will be a deal breaker in terms of the national program thinking of incorporating it?
I think few people will take it as a license, PrEP as a license to have like unsafe sex. And people really don't like many barriers between sex and them, as a condoms, as a medicine, and things like that. When I'm alright, why I need to take a medicine? So this kind of situation is over there. Even if you are diagnosed of HIV, let's suppose in our organization, this year HIV prevalence is 6%. Last year it was 3%, and in 2014 it was 3%. So, like incidents, there are more and more incidences of HIV. But this is very difficult, like to bring people on medication and things like that. And definitely, yes, people will use it as a like tool, as a license.
Sorry.
Yeah.
Okay,
Yeah.
good. You've mentioned change in behavior, regular testing and all. Maybe you can just like give us clarification on that one. Your behavior in terms of HIV testing. So that's a positive change, right?
I was getting tested like crazy. So I mean, after take PrEP, yes, I still got tested, but less frequently, about 3 months or 6 months. Yeah. But I also got tested for my liver and other parts. I mean, it's a good health routine actually to know what's also happening inside my body. So, but you know, I have been maintaining pretty relatively healthy life. So.
As your body shows. Q&A?
Should we go now to questions from the audience? And you can ask them any question, daring questions.
Please do.
Yes, sir. Maybe your name and.
Hi, my name is Alex Gardner. I'm a Hornet. My question actually is about one of the issues that I feel like we've skirted around this entire conversation, which is fucking. And we mentioned barebacking, and it was sort of a theoretical discussion that people may bareback. But I think fundamentally the issue about PrEP is that gay men want to fuck, they don't want to use a condom, and they want someone to come inside them. And that as gay men, we have to be able to say that out loud and claim it as having value and being legitimate, because at the core of the PrEP issue is the stigma associated with sex without condoms. So I guess my question to you all is to speak to that, to the idea that what it means to have sex without condoms. Is it something that informs your, that drives the sexuality that you have? Is it something that you prioritize? Like, how does that part, which is the part that we never talk about, how does that part fit into this conversation?
Well, we do.
Let's do it.
We do talk about that. I think we just adjust, I guess, depending on the venue. And, you know, especially coming from this region, the context about any conversations around HIV prevention is complicated. And there are so many misconceptions that you have to address. And I think advocacy around PrEP would have to be context specific as well. It's not easy. Again, for example, that case where I told my friends about PEP, and it shocked them already. And imagine the idea of saying that condomless sex is not bad. You've been raised thinking that, you know, being gay, you're already committing immorality, and then if you get infected with HIV, then you become a double burden to your society. These are certain barriers, and I do agree that there should be a frank and honest discussion around condomless sex. But I think it's advocacy-wise, it's also natural for many advocates to contextualize the conversations that we engage in.
So for me, I feel like the goal, I don't care about stigma very much. I always keep a very simple goal, that is to promote and protect my health. So the use of condom or the use of PrEP, I use them alternatively, or I mean also them together, or you know, I do take prep sometime like on demand as well. So it means that I would anticipate the period when I actually want to have sex. But also during the period when I feel like, okay, that I don't have prep, but suddenly, it's surprise sex or something, I don't know. But I always employ all the stuff to protect myself, like condom, for example. So I always keep the goal in my head that, okay, to protect my health, but that's it. Otherwise, different tools, whatever out there for me to employ, to use, I'll just take them. So people tell me, okay, you're having sex with condoms, without condom, I think, okay, but as long as I'm healthy, I'm fine.
Just a clarification, what is surprise sex? No, what is on-demand prep and daily prep use?
Okay, daily prep use is you take 1 pill a day every single day for as long as you want. As long as you still want to be protected by prep, then yes, it's daily prep use. And on-demand, I think there are at least several different kind of on-demand, but on-demand, which means that you use prep when you want to use prep, when you anticipate that you have sex, at least 2 hours before your sexual encounter. You take 2 pills 2 hours before that, or you take and then like 1 pill after that, right?
And another pill after that.
So that's surprise or planned sex?
Well, it depends. If it's too surprise, then you cannot really. Yeah, you have other tools. Like you have a variety of tools to use out there. So don't rely on 1 or 2. It's just do whatever you can to protect yourself, right? And you can also take it for a few days prior to having sex as well, like at least 4 days. That's also okay.
Thank you. Any other question about fucking and all? Oh my god, I might get fired tomorrow. You first and then.
Okay, it's not my question, but the section is being live streamed on Facebook. So we have 2 questions from our viewer. The first one is for Wu. There's one young positive fellow asking that he's undetectable, and now you are a PrEP user, and do you feel safe? Are you ready to fuck safe with another positive dude? That's your question. Another question is for Tenzo from our college in Pakistan. Is PrEP available in Pakistan right now? And we really need awareness about PrEP and how to use and how we can relate transgender community with PrEP.
Okay, question for me. So this is not will I or will not, but I did have a second encounter with a person living with HIV before. So and as I mentioned earlier, as long as there are a variety of tools and I can use them to protect my health, then I think it's fine. Again, I think some people say that you use. I think they think that use PrEP as an excuse for direct sex and stuff. I don't think it makes a lot of sense because really, if you actually should be responsible for protecting your own health. You shouldn't rely on the fact that somebody is using PrEP or not to engage in, for example, condom-less sex, because ultimately in the end it's you and your health.
That's you.
Yes, I think the question was if PrEP is it's not available. Secondly, if that person needs information regarding PrEP. There are 6 CBOs at the moment working in different cities of Pakistan, and I don't know which city he belongs to or she belongs to, and they can come to our office or I can share the contact details.
Okay. There's also a question on transgender, but I think we're focusing on.
Yeah, that's what they're saying. If that is how we can engage the transgender community. So we have offices in Pakistan. So I don't know where they are situated.
Okay.
Yeah.
We'll work on that. Yes.
I just want to clarify on PrEP on demand. I think the standard protocol is 2 to 24 hours before a sexual encounter. You take 2 pills, and then 2 pills every 24 hours. And another question I just want to contribute that you asked, that would it increase the use of recreational substances, PrEP? I think for this region, anyone who's willing to go through the price and the accessibility, everything taken into account. So anyone taking PrEP is pretty serious about not contracting the disease. So probably it won't affect that behavior. So unless I'm wrong, that's what I believe. So,
Yeah, and actually studies of PROUD already stated that there are really no increase or there in terms of STIs, in terms of chemical use. Yeah. Would you like to add on this? No.
Chemsex.
Yeah.
I guess that's exactly one situation where PrEP is quite effective, and you have a hard to reach subpopulation wanting to protect themselves from HIV infection. So that's where PrEP is useful. There's another point about condomless sex. I think we need to reframe our conversations around unsafe sex, because with PrEP, in terms of HIV protection, condomless sex is safe sex. So we should stop equating safe sex to condom use alone, because with PrEP there's now a variety of ways to protect yourself from HIV infection.
Any other question?
Hi, I'm Anthony from Kenya. Listening to the conversation, and PrEP is actually available in Kenya, I have actually noticed an increase in barebacking, because I wouldn't know what's happening in people's bedrooms, but when you have that conversation, there is an increase in barebacking. And this conversation, as he said, we need to actually talk about fucking. We need to actually talk about having someone come inside you. So that is a conversation that needs to happen. And like you said, it's very, one has to approach this conversation in a very contextualized form, because in Kenya, I'll talk about Kenya because that's where I come from, it's really a taboo topic, sex itself, sex in general, it's really a taboo topic. And we need to find ways to actually talk about barebacking, talk about sex in general. But that aside, and consent aside about barebacking and condomless sex, as you just said, actually, I was just listening to you, as you just said, Jonas, it is safe sex in terms of HIV prevention, taking PrEP. But there are other, there are other STIs, there are other diseases that you can actually contract by having condomless sex. So how do we address that? How do we address the fact that there is an increase in condomless sex because of PrEP, and the fact that there are other things that you can contract while having condomless sex?
I want to talk a little bit about this, because you said there's an increase in backpack sex, but I think until we have a formal study or properly conducted research, we cannot really conclude this, although it's a real conversation. Because from me, from my own experience, I'm not gonna lie, but I did use condoms more often after I took PrEP over time, because there was a period that I couldn't use condom and I was very worried about my health. So that's why I decided to get on PrEP. But over time, it wasn't because of PrEP or because of without PrEP. When I changed my mood and also I snapped out of my emotion, I started to use condom again. And also I was aware of my health condition, so okay, I should actually use condom so that I don't have to take PrEP all the time to protect against my health. So I think it's really case by case, and in my case, I wouldn't say that PrEP provides me opportunity to have condomless sex, because I did increase my condom use over time after having PrEP.
Okay.
I think the question was, there's actually evidence already, and I understand that in some countries they've actually noted increase in STI incidents as well. But I think that goes back to the point about making sure that our HIV programs or sexual health programs for gay men, or for other key populations, is comprehensive, and it covers not just provision of PrEP, because really we have to disabuse the notion that it's a magic pill to address the epidemic. We need to have better programs as well on STIs, make sure that we cover education programs on how to prevent other STIs.
Yeah, thank you. And actually, just to add on that one, the PROUD study indicates that there were no change in terms of condom use. So the behavior actually improve or stay the same. Yeah.
It depends, maybe, yeah, it depends on the region and the country. It's the context is different. That's what I think Tony was mentioning. In Kenya, it is indeed the barebacking is getting increased. In Europe, for instance, there is Guy Romeo who's launched like 2 years ago, I think, that research, and it proves also that the barebacking is getting increased in Europe from year to year. And in France, the recent research that was published from the Public Health Ministry proved also that the STIs got increased, and amongst others, the syphilis, gonorrhea, and gonocoque are the main 3 STIs in France that increased during this PrEP period. So it depends of the region and of the country. So nothing is.
Just to add on that, I mean, you can look at all the apps that we use: Scruff, Hornet, Grindr. Whenever someone says they're on PrEP, they want condomless sex, and that's just. I mean, it's something that we notice.
Yeah, but I guess we have to remove some or identify some moral questions around that. I mean, if they're looking for condomless sex, so what? Is that inherently bad or wrong? Again, I think the beauty with PrEP is that you can have honest conversations about how do you protect yourself and you protect your own sexual health and well-being in those situations. So it's better than having these pre-existing notions that when someone tells you that he's safe, he's not HIV positive, then that's already fine. You base, or if you enter into a monogamous relationship, you're already protected. I think PrEP, the advocacy value is that you get into these conversations that is not discussed commonly.
To your point about barebacking, I think what we've seen is there's more people who are willing to speak openly about participating in barebacking as opposed to the rates of barebacking going up, right? We don't even have a baseline for like the rate of people who are barebacking to begin with. In the US, I think it was about 16% of gay men consistently use condoms over the course of a year. So for it to go less than 16, seems insignificant at this point, right? But I think that the larger question about STIs, and I think that I'll pose this to the group. When people say STIs are going up, I guess the question we have to ask ourselves is, so what? What I mean by that is, we know how to test and treat STIs. So if someone's coming into the clinic and they're getting an STI and it's getting treated, that's great. But the challenge is that, and I think Boo mentioned this earlier, this whole issue of stigma. So I guess my question is about the issue of stigma, not just around sex without condoms, but we've done very little work around stigma and STIs. It's still very sort of hidden and unspoken about. We don't want to tell someone we got it, and it's very embarrassing. But at the end of the day, it's simply inconvenient. It's inconvenient as having the flu. So I'm curious, sort of, what are your thoughts in terms of how we can sort of more effectively work to destigmatize STIs?
Yeah. I think it's with correct medical information. I think when you can send a text message and say, hey, it was really great last night, however, I've noticed this, and this, I think it's likely to be crabs. If you've never heard about that before, it's this, and this, and bang, that situation has solved itself because you are completely empowered. And by the way, you can pick this up from the pharmacy. By the way, I've got this particular discharge, and I've worked in a sexual health clinic for a lot of my life, so I feel comfortable saying discharge. Sorry, I realize not everyone wants to hear that on a Monday afternoon. Like when I hear the word "I've got discharge," my first question is, what color is it? Like that's the kind of medical information that I expect young, informed, excited about sex gay people to react to an idea about possible being exposed to an STI. So again, it's yes, we are scared of sex broadly. Talking about sex. Yes, we can move forward with that. And yes, comprehensive programs that include education where people aren't freaked out by this, or this is really important. Starting it early with vaccinations and stuff like that for HPV and all of that, I would love to see that. But at the same time, you're not going to go to your government and be like, I love to take it in the ass and allow people to come inside me. That's why I'm here today for the meeting. That's not always going to work.
I would love to see
Yeah, I mean, it would be hilarious, but it wouldn't work out well. These are conversations that need to have. I think PrEP starts to open up that space to have those conversations, but the nuts and bolts of education and all that kind of stuff remain. This is just an added part to it.
Yeah. But I also think that we need to build our infrastructure for community-based responses, for community-based facilities, because it's the most effective platform where we can have this kind of conversation. Definitely not with your government officials. We haven't even convinced our government to fund condoms for MSM programs. So we need to start with our
straight community in the country as well.
So we need to build that infrastructure for our community-based response.
Justin, that's Justin.
I think it's better. Hi, I'm Justin from the United States. I think something that really has helped me is that a lot of people will then say, well, disease in general is bad. It's something that we should try and prevent, or that we should look at as something that's bad. But I always think about it, well, there are people that get cavities because they're not practicing proper oral hygiene, or there are people that break bones because they're participating in activities that cause broken bones. And we don't stigmatize or shame them as a result. We see this as a natural consequence of that behavior, and we allow them and we encourage them to get the help that they need. With regards to STIs or STDs or anything else, the reason that's so stigmatized is specifically because it's caused by sex, which continues to be a subject that is so taboo everywhere around the world as far as I can tell. And so I think the point is we need to start normalizing sex. We need to start normalizing STIs and STDs because they happen all the time. And it's just something that's going to happen if you engage in sexual behavior. Just as if you engage in some sporting events, you're likely to get an accident or get hurt or something of some sort. And work to really create systems that don't shame or discourage people from participating or getting the help that they need if they have participated.
Good point. Yeah.
I want to bring back the point of consent when talking about increase in bareback sex, because, for example, I do include bareback sex in my conversation with people online, and I realize that people who want to have bareback sex will have sex with people who want bareback sex, and those who want to use condoms will do it with condom with other people. For example, won't ask somebody or force somebody to have sex with me without a condom if they don't want to, for example. So it won't increase the percentage of people having bareback sex or not, because, those groups, they have sex without condom, those who have sex with condom. And as long as, there's a consent there and you're not going to violently force somebody to have sex with you with the kind of sex that they don't want, then I think all the percentage will just stay the same. Because you cannot go around, hey, I have PrEP and I want to have bareback sex, and people will say, oh, yes to you, because they don't know if you really have PrEP or not. There's nothing to prove it.
Okay. We have less than 15 minutes. Who else has burning question? We've talked about barebacking. We've talked about discharge, STI, orgies. No orgy. No. Anything? Any question? No more. Okay. So I'm going to. I'm not going to summarize everything, but I'm going to put it back to the panelists. So I'm going to give you one word, and on that one word you can correlate it with PrEP. And that will be your final statement. So, Vu, your word is responsibility.
For me first. So I think responsibility is good actually if you take responsibility to care about other people's health. But I think first and foremost you should be responsible for your own health, which means that you do whatever you can, whatever you want to protect your health. At the same time, even people tell you that they're on PrEP and they have sex with you, you take their words at your own risk. You should be aware if you're on PrEP or not, or you should be aware if you're using condom when you have sex or not, but don't blame other people after any consequence that you're going to have. Ultimately, you should be responsible for your own health. That's it.
Thank you, Vu. Jonas, empowerment.
I think, as I've mentioned earlier, PrEP is about an informed choice, protection according to your own terms. And I understand why it's scary for many people because informed choice has always been questioned when there's inequality. It's a tool to fight inequality, and that's why many people are scared about it.
Okay, thank you, Jonas. Tanzil, challenges.
Challenges. Definitely something on which you do not have any control on, but I think this is the beauty to have a challenge, so you can do something. For just thinking about the PrEP, the biggest challenge is, I think, a perceived challenge will be affordability and accessibility in Pakistan.
Okay, thank you. And Garrett, rights.
Yeah, I think rights is the baseline and everyone has access to it, but then you need to make that choice or decision of what you're advocating for, what works for you and things like that. You may have a right to something, but how do you want to take up that right and how does your government want to help you do that? So rights just the very beginning, so I guess it would be choice, very similar to Jonas. That's what we need to focus on.
Okay, thank you everyone. Thank you to our panelists. Just as last word, PrEP is here to stay. I think, but we need to have this discussion, this frank discussion about sex, about barebacking, and everything attached to PrEP. We need to have the discussion. But as Jonas clearly stated, there needs to be program, there needs to be services readily available to address also those concerns. So thank you very much to everyone for coming, and we'd like to thank APCOM and Youth Voices Count and the Multi-Country South Asia Global Fund HIV program for making this session possible. Thank you, everyone.
So thanks again. There's refreshments outside, so you guys can enjoy that.